So as Len said, my name is Elise, and today I will be presenting to you on my practicum experience at the Island Sexual Health Society. First and foremost, I'd like to get out of the way. I really want to thank Lynn Davis and Betty Taylor, as well as my whole cohort that I've worked with over the years. You guys have all been excellent in supporting us, and everybody has been a great team to work with throughout the duration of the program. So the Island Sexual Health Society is an organization that provides sexual health services to Southern Vancouver Island. They serve approximately around 30,000 clients per year, which is pretty impressive for the small little clinic that they are. But not only do they provide clinical services to clients for things like PAPS, HIV, STI tests, and access to contraceptives and birth control, but they also actually do a large education outreach in the community as well, for everybody too. So all cultures, genders, orientations, religions, you name it, they provide the services for them. So although I had many tasks in my practicum, I'm going too fast there for myself. One of my initial assignments was to develop a 1 to 2 page resource on HIV and STIs for new immigrants and refugees in Victoria. This arose from a lack of sexual health resources available for newcomers that were ethnocultural friendly. The resource was made for the Intercultural Association of Victoria and in collaboration with AIDS Vancouver Island. So the objective in the end was to hopefully increase newcomers' awareness of STI and HIV testing, treatment, and prevention, as well as how to access resources in the actual Victoria community. To help me understand this health literacy challenge, I applied the health literacy blocks adapted from Vamoose and Hayos. Although all the blocks could be used, the ones that were most applicable for my role included the audience, barriers, enablers, as well as the service and delivery. So getting to know the audience was an important step. Unfortunately, I myself didn't have the opportunity to be involved in the actual sessions that were hosted by ICA, Island Sexual Health, and AIDS Vancouver Island. They opted to host 8 sessions in total to get to know the clients, provide information in the sessions, and get feedback on the comfort levels for the material. So since I did not have the opportunity to do that and participate in the sessions, I opted to do a literature scan to familiarize myself with the audience and to better understand the barriers that they can face when accessing sexual health resources. So some of the barriers and enablers that I had identified during the literature scan, and also got some feedback from Island Sexual Health from attending the sessions. There were challenges included things such as gender power differentials, lack of medical care coverage, racism, healthcare provider discrimination, language barriers, poor access, especially for the immigrant LGBTQ community, low health literacy levels, traumatic childhood experiences, and cultural sexual taboos and stigma. There's also concerns of confidentiality and just the perceptions of risk of going in for treatment. So, to enhance the delivery and the development of the resource, we ensured that it was culturally and linguistically appropriate by providing it in the top 5 settlement languages in Victoria. And the English version was provided in clear and non-convoluted English. We wanted to make sure that lots of images were used and that lots of white space was also available to make sure that the material was actually easy to read and anybody could hopefully pick it up and be able to take something away from it. Another focus that was really important though for us was the cultural safety, diversity, power differentials, and self-efficacy. We wanted to make sure that somehow it was incorporated into the overall program project to improve ICA's capacity to provide sexual health resources. So, to ensure cultural safety, the content was presented from a worldview. However, it was acknowledged that diversity should be incorporated when possible, as sharing the same language does not mean that a person will have the same cultural background or belief systems. So, to help integrate diversity into the overall goal of improving the capacity of ICA to provide sexual health resources on things like STI and HIV prevention, they opted to be training peer-led facilitators to enhance the client's ability to have access to somebody who, you know, has a better comfort level and who they can trust and who they can relate to their experiences, and also someone who won't perhaps misinterpret or convolute the sexual health experiences that they share. It can help to enhance the client's resiliency and helps to avoid stigma that can sometimes occur between a provider and the client. So for my overall program and project, for what I particularly encountered, I would say that all the values of the School of Public Health and Social Policy applied, but for my role in particular, the ones that I encountered the most that I noticed was the diversity and cultural safety, as well as the interprofessional and multidisciplinary approaches and partnerships with people and populations served. So when creating the resource, it was important to consider the diversity of the clients that will access the information variation of knowledge, and then for the multidisciplinary approaches and interprofessional, the stakeholders are all working together really well with for ICA, Island Sexual Health, and AIDS Vancouver Island. And lastly, of course, it wouldn't be possible without the partnerships and input and feedback from the clients. Thanks.
Thank you, Elise. Questions, comments? Yes. Asha.
Hi, that was awesome. I'm just wondering if you can talk about some of the messages that would be used and like kind of some of the focuses that you were really looking at and how those were developed, and especially with people from different cultures, like how you from various cultures is what I mean, like how you thought about how to do that. Thank you.
Yeah, so when developing the resource, it was really, they wanted it to come from a worldview for that reason, because there'd be a lot of different people that are accessing the resource. So for me, I was kind of at like the bottom of the funnel of information, you know, like for what I was tasked with. So Island Sexual Health, AIDS Vancouver Island, ICA were collaborating a lot with the clients. I was just receiving a lot of the information at the bottom, and then if I was to develop something, I would go back to them and go back to the clients. They would give me feedback, and then I would alteration it as it is. But the main focus for the pamphlet itself was to include really essential things that anybody should know, and specific to the Victoria, where can you access sites for STI and HIV testing in Victoria, answering questions like what is HIV, what are other sexually transmitted infections, how do I prevent getting an STI and HIV, how do I know if I have an STI or HIV, and when should I get tested for an STI or HIV. So a lot of that just came from prior knowledge from those organizations working so much in the area already. So like I said, like it's great that I had them as the resource, but it was certainly in the funnel world, if you want to say that. I was at the very bottom, but they were excellent to help filter that for me quite a bit. Yeah.
One more quick question, if we could.
I'm just curious, what other languages other than English was it translated to?
Okay, so I have that in there. So Mandarin, Cantonese, Punjabi, and sorry, I have that written here somewhere. Filipino is one, and I know the proper pronunciation for that. I always say it wrong, is Talago, I believe. And then there's also German as well, actually, was one of the ones that was put in for the settlement. Yeah.
Thank you, Elise. Good
Okay.
job.
Thanks.